delay, but we are now online. Today we've got a lot of material to cover. The Lieutenant Governor is with us today and to announce that we're infusing $10 million into arts and cultural organizations all across the state of Indiana. These are those exact organizations that bring so much flavor and definition to our state, community by community. And I alluded to this last week, and I'm really excited to hear more about that here in a few minutes. But first, I also wanted to share a couple updates on three other fronts. Those being the moratoriums to prevent eviction and foreclosure proceedings from starting, and the discontinuation of utility services that are all set to expire on August 14th. That is how we will proceed going forward, but I don't want this lost. Here's the most important thing. We do have programs and funding and resources to help residents who are in need, who need to have access and who qualify to funding and to payment plans. And so I want that to be crystal clear that if you are in need, we are here. As a matter of fact, we're constantly urging Hoosiers to work with their banks, to work with their landlords, to set up these payment plans as we go forward. We're also, as you may recall, when we announced this program back in June, late June, I think it was June 24th, we put in $15 million for that rental assistance program, and we're adding $10 million more to that program as well. And Jake Sipe, with our housing department, who reports directly to the Lieutenant Governor, he's with us as well. And Jake, you'll give us a broader and more detailed update on those programs. Also, Joe Herons, we'll hear from him as well. I've asked him to share some more information about some settlement facilitation that we're working on as our members of the court upstairs, to make sure that we're helping landlords and tenants reach agreements outside of an eviction judgment. So, and then, of course, we'll go directly to Dr. Box, and she will give us the latest data that we have on the ground that's helping us make all our decisions, but especially complementing schools as they arrive at decisions, one locality from the next. School is in session for much of Indiana already, and will continue to be throughout the rest of the state as the days and weeks ahead unfold. So again, we'll hear from Dr. Box, then the Lieutenant Governor, then Jake Sipe, then Joe Herons, and then we'll go right into the Q&A, Rachel. So with that, Dr. Box.
Thank you, Governor. Good afternoon, Hoosiers. Today we reported 740 additional cases of COVID-19 in Indiana, which brings us to 69,975, the total number of Hoosiers known to have COVID. We also saw 12 additional confirmed deaths. To date, 2,805 Hoosiers have died of COVID-19, and another 202 are believed to have died from this disease based on their clinical diagnosis. We've seen a slight increase in the number of COVID patients requiring ICU beds and ventilators. Currently, more than 32% of ICU beds and nearly 82% of ventilators are still available. About 14% of occupied ICU beds are housing patients who have either been diagnosed with COVID or have symptoms of COVID. More than 3% of ventilators are being used by someone who has COVID or suspected of having COVID. We also have seen more than 792,000 Hoosiers tested for COVID-19, up from more than 724,000 a week ago. I also want to update you on our latest data from our partners at Regan Streif. Regan Streif has looked at 68,191 cases in total. Of those, about 22% visited the emergency department, which is down slightly. A total of 9,059 were hospitalized, which represents 13% of all positive cases. Of those who were hospitalized, 21% were admitted to the ICU, which is consistent with what we have been seeing. That represents 3% of all positive patients. 72% of hospitalized patients have been discharged. Of the remaining 26%, 9% are believed to still be hospitalized, and 19% are known to have died while hospitalized. Regan Streif also estimates that 76% of patients have recovered. While these numbers are holding steady, we continue to keep close watch on our hospitalization data. We also continue to see increased hospitalizations for COVID-19. On June 26, 595 individuals were hospitalized with COVID-19 across the state. Yesterday, that number was 923. We've also seen the daily admissions climb. We're paying close attention to these data points, especially now when many of our schools are reopening either in person, virtually, or in a hybrid model. I get a lot of questions about whether schools should be opening now because we have more cases than when our schools were shut down in March. We shut things down in March to prevent a surge that would overwhelm our healthcare system. That allowed us to build the infrastructure for testing and secure the needed ICU beds, vents, and PPE to ensure our hospitals could manage the outbreak for the long term. We were successful in those efforts, so the conversation now about schools reopening is really quite different. I continue to believe that our schools can safely reopen by wearing masks, practicing social distancing and good hand washing, cohorting students, and ensuring that people who are sick or are close contacts of someone with COVID stay home. This does not mean that our schools will be free of COVID. What it means is that we all need to do everything possible to limit the spread of COVID. I cannot stress enough how important it is to stay home if you're sick. If you have symptoms and you're waiting to get the results of your COVID test, stay home. If you're a close contact of a person who's tested positive and don't have symptoms, stay home for the full 14 days of your quarantine. And parents, please make sure that you're screening your children every day before they go to school. We're counting on you to help. We've also had cases in schools where students and staff have had to be quarantined because a symptomatic individual came to school, or even an individual who knew they were supposed to be quarantined came to school and then became ill. The best way to prevent this is for everyone to do their part and know when to stay home. I know that teachers, administrators, and parents across the state are searching for that one single metric or number we can use to guide us as to when it's okay to open schools and when schools would need to close down. There simply is no single benchmark that accurately represents the level of community spread for every county in our state. The 7-day positivity rate is certainly one metric to look at as we help guide superintendents and public health officials in each county as they make decisions for schools. But that cannot be the only metric that is considered. For example, a high % positivity could be due to cases in a long-term care facility. Counties with a high number of cases related to outbreaks in congregate living settings or industries are different than counties that have a wide spread of numbers of cases randomly throughout their community. Other counties may show high positivity rates based on the low number of testing that occurred during that period of time in their county. So also looking at the number of tests per 100,000 individuals is important. Just like in our Back to Track plan, when we assessed 4 different metrics, it's important to look at the whole picture for a county. These are some of the factors we will examine as we help school and local officials as they make decisions. Other factors that we study on a community level are changes in that 7-day positivity rate, the number of tests per 100,000 individuals, the sources of the outbreaks, emergency department visits for influenza-like symptoms or illnesses, and emergency room visits and hospitalizations. I also have been asked how many cases of COVID in a school would cause that school to close. Again, that depends on whether those cases are localized to one classroom because the school has done a great job of cohorting those students, or whether those cases are spread throughout the school in different grades and different classrooms. These are decisions that are made with your local public health department and your school officials. We are here to help them understand the complete picture of what's happening in their community. We're also getting questions about how we will know whether a positive case is linked to a school and whether we'll be posting that data. Our contact tracers will ask each positive case if they attend a school. This will help ensure that schools and local health departments are informed so that they can move quickly to quarantine anyone who is a close contact. I would say that there's personal responsibility here in that I hope that every school has asked every family, every parent, every student to report immediately when they get that positive test result to their school. We've seen this work very well in several districts this week when cases were identified in a student or a staff member. We understand that there's a lot of interest in knowing about positive cases in schools, but there are a number of issues at play that we are considering as we think about this. First, many of these cases will involve minors, which requires us to look carefully at what data can be shared and how. Secondly, unlike long-term care, we have to navigate both HIPAA and FERPA privacy rules. I want to emphasize that having a case of COVID in a school should not be a cause for panic or a reason to close. It's a reason to take action to prevent an outbreak. And we've been working with schools and local health departments to ensure they have the tools to do that. We've developed a number of back-to-school resources on our website at coronavirus.in.gov. We've created a hotline for school administrators, which we shared with them today. We hired a school nurse liaison who has been hosting weekly webinars for school nurses and administrators to answer their questions. And we're also finalizing a toolkit for schools to provide easily accessible resources, such as symptom checkers, contact tracing checklists, and guidance on quarantine and isolation. We will continue to develop guidance to help our schools through this unprecedented time so that students and teachers can have the best and safest learning experience possible. Thank you.
Thank you. Lieutenant Governor Crouch.
Thank you, Governor Holcomb. And Governor Holcomb and I know that our arts and cultural organizations are especially vulnerable right now. Our arts, culture, and local traditions all make considerable and necessary contributions to the well-being of our communities. So today I am pleased to announce that the Indiana Destination Development Corporation, headed by Elaine Beadle, is providing support with a new grant program totaling $10 million. The funding comes from the CARES Act to support local arts and cultural organizations and to help preserve events and festivals who have been negatively impacted by COVID-19. Applications will open this coming Monday, August 10th, which, by the way, is my husband's birthday. More information will be available on Monday at the Visit Indiana Tourism website listed on the current slide. Travel, adventure, and family fun make up so many of the memories that we cherish and hold dear, and they help to tell Indiana's authentic story. We developed this program to assist and preserve the many Hoosier hospitality destinations, organizations, communities, and individuals that help enhance the quality of life that we enjoy in this state. Thank you, Governor, for your leadership on this and your partnership.
Thank you. With that, we will move to Jake Sipe, and we'll hear more about the moratoriums August 14th and going forward.
Thank you, Governor. Today I want to talk a little bit about an update on our rental assistance program and highlight some of the rental assistance application process, and also I want to remind our Hoosier homeowners of the Indiana Foreclosure Prevention Network. The rental assistance program has more than 24,000 applications that have been submitted. And with those 24,000 applications, we have 5 counties that represent 45% of the total applications we have received. Of those, 18% of those applications have come from Lake County. St. Joseph County has about 10.5% of our applications. Allen County is at 8.4%, with Tippecanoe and Vanderburgh County both at about 4% of the applications we've received. The next slide here shows the rental assistance program volume by day and the applications that we're receiving. And when we opened up the portal on July 13th, clearly there was a huge volume of applications that we received, actually just over 8,000 applications. But since that day, there has been a steady decline in the number of applications that we've been receiving with the rental assistance. And today, we're hovering around 400 applications per day. As you can see, that steady decline and starting to taper off around the 400 applications per day. Now I want to cover again some of the criteria of our rental assistance program for Hoosiers that are outside of Marion County. Now, just a reminder, Marion County has a separate program that they also administer. Renters may be eligible if they have lost income because of the pandemic. Applicants cannot receive rental assistance from another source during the same month when participating in the state's program. And I want to make sure that folks understand this. There are opportunities for our communities to have local rental assistance program that can come alongside the state's rental assistance program. However, when that happens, they just can't receive the rental assistance in the same month. So, for example, our township trustees, our faith-based organizations, and our not-for-profits certainly have rental assistance programs that they're offering currently, and we can come alongside them. But however, we have to ensure that we're not providing the assistance within the same month. Now, renters may be eligible if they are having trouble paying their rent and face foreclosure, eviction. Now, payments that go out go directly to the landlord on the behalf of the renter. So for the rental assistance program, information for renters and landlords outside of Marion County may be found at indianahousingnow.org. Information for Marion County's rental assistance program is available at indyrent.org. At IHCDA, we have over 60 statewide partners, and we also have about 20 members of the Indiana National Guard who are assisting us in reviewing these applications. Now, this week, some of our participating lenders began receiving payments. Now, I also want to remind folks the application is open and we are accepting applications. And if you're interested in applying or finding more information about the rental assistance program, it is available at indianahousingnow.org. Now, the Indiana Foreclosure Prevention Network helps Indiana Hoosiers who have fallen behind on mortgage payments or cannot make future payments. And if you're in that situation, you can go to 877gethope.org, or you can call toll-free at 1-877-GET-HOPE. Governor, that's my update for our programs.
Thank you, Jake. And you remind me as you were speaking there that I should clarify, we're adding $15 million to the current $25 million that equals a total of $40 million. So there is currently $25 million. We are now adding 15. I think I said 10, 15 to a total $40 million. And with that, Joe, you want to talk about the mitigation and avoiding.
Good afternoon, Joe Herons, General Counsel here in the Governor's Office. In addition to the state's rental relief program and the additional funding that we've announced today, there is another statewide program being developed that will also help tenants and landlords after the Governor's eviction moratorium ends. It's called a Settlement Facilitation Program, and it will be available at no cost to tenants and their landlords in eviction lawsuits. Funding will be provided by the Indiana Supreme Court, the Indiana Bar Foundation, and the state through CARES money, with more details about that to be forthcoming. We have been discussing this new program with Chief Justice Rush, and it's being developed by Indiana's Office of Judicial Administration. For those who are unfamiliar with settlement facilitations, they have been used in mortgage foreclosures in our state for almost a decade, and they can be a good choice for resolving disputes. Here, in connection with this new landlord-tenant program being developed, the tenant and landlord will meet with a neutral person who is trained to help them resolve their disputes voluntarily instead of it being decided by a judge. If the tenant and landlord come to an agreement, that ends the dispute without the need for additional court hearings or trials. This can be an effective and frankly less onerous way to resolve disputes, and it is oftentimes has the added benefit of preserving the existing relationship between the two parties. This is another program that will help preserve housing stability in our state. Chief Justice Loretta Rush provided the following quote, which I will share with you. Since 2009, the Indiana Supreme Court's Mortgage Foreclosure Trial Court Assistance Project has helped avert foreclosures by facilitating settlement conferences between homeowners and lenders. We are expanding this vital program given the pandemic. Similarly, we are working hard to develop and implement a fair and reasonable program to help courts manage the backlog of eviction cases, and we thank the Indiana Bar Foundation and Governor Holcomb for partnering with us on this project. I would just close by noting that the specifics of this new statewide landlord-tenant program will be announced in the next few weeks, and Chief Justice Rush or someone from the courts we'll be here to talk about it when that occurs.
Thank you, Joe. And with that, Rachel, let's move right on to the Q&A.
Emma Kate Chalkbeat.
Good afternoon.
Hi, Governor. I wanted to ask how reporting positive cases in schools would violate HIPAA or FERPA rules, especially if the state is not releasing identifying information, and considering that many schools are already publicly announcing when they have a case.
That's an excellent question, and we are not sure that it will. But those are the things that I'm considering as we look at the entire picture. I just don't want to commit to something that if there is a legal reason or another reason that I can't do it, that I'm now committed to doing it. So I promise you I'm working very hard to try to get to yes on this.
Kayla Sullivan, Box 59.
Good afternoon, Kayla.
Good afternoon, Governor. What is your reaction? I have two questions, by the way. The first one, what is your reaction to accusations President Donald Trump is the reason Indiana isn't allowing a no-fault absentee ballot election?
Inaccurate.
And can you further describe why? I mean, what would you say to someone who is maybe at high risk for COVID-19, but doesn't fall under the reasons to vote absentee in Indiana legally? Are you asking them to choose between their health and voting safely and the right to vote? And will masks be required at the polls for workers or voters?
Yeah, there's a mask requirement, and Indiana will have a safe and secure and healthy in-person election on November 3rd. We had one in the primary. Now, obviously, in the primary, we moved. We were in a stay-at-home order during that time period leading up to it. We moved our primary election from May to June. And as Secretary of State Connie Lawson said, the voting sites all had PPE. They were all able to conduct safe elections. I don't know of a single case. I've asked this question 10 times, 10 different ways of 10 different people. If they knew of one case where someone got COVID-19 while voting at one of our polling sites on election day, and the answer has been no to date. And so we need to have that option. And there are, as you allude to, a number of reasons, a long list, quite frankly, of reasons why people can start to vote, whether it's in person and less congestion, 28 days, that's 4 weeks before the final election day. And then you can also vote absentee, as you say. And if you're confined on election day, if you know you're going to be confined on election day, then you check that box. If you are, there's age limits, there's all kinds of reasons why if you can't get there. I will also say this, there is a case before the Attorney General right now. We hope to learn more about that. This will also inform us as we go forward. In that case, hopefully will be resolved. We'll get an opinion down around the Labor Day. But folks need to understand that it is safe to vote, just as it is safe. When we talk about back on track and we look at mobility patterns, there are a lot of people out and about, whether it's working or going to the grocery or doing your lives, and they're doing it safely. And we can vote safely in person as well. We deserve to have those, first and foremost, those safe voting in-person options. We have those. We also deserve to have a very timely election results. We call it election day, not election month. And I hope as we work on this front that we'll get that right going into November 3rd, and we will.
Kathy with the Ferdinand News.
Good afternoon, Kathy.
Good afternoon. I wanted to tell you, we did a happy dance, by the way, here in the office when you announced the mask requirement because, well, we come to work every day and we're kind of have to go out and about some, and we were very, very happy. So thank you for that, first of all. I have two questions.
It's teamwork.
Yeah, I believe that. I see that. Mm-hmm. My first question is, I'm in an area where there's a lot of small rural schools and people live in rural areas. Is there a plan maybe coming forth from the Department of Education or anything sort of to help to make sure if for any reason the schools are shut down, that those kids have access to the same quality of education that everyone will get? That is my first question.
Okay. Katie is,
Moving to the podium.
she's jogging to the podium, actually.
It was far from a jog, I assure you, a fast walk. Thank you for the question, Kathy. I'm Katie Jenner, Senior Education Advisor for the Governor. I think the first thing I'd like to emphasize is the Governor shared, very exciting, school is in session in Indiana. And we had several schools start last week. We have quite a few more this week and more to come. And to pause really quick, a huge, enormous thank you for our school district educators and our local health departments. You have proven to be incredible partners in working to solve for getting our students back to school. What we're seeing right now is the vast majority of our schools in Indiana are going back with an in-person option for kids and families. And talking to many superintendents and educators throughout the state, their hope is to continue that and, again, work with their local health departments to continue to ensure safety. If it comes time that their local data shows that they need to make an adjustment, the districts have plans in place to do that. But again, the hope of many is to keep our kids in school. Thank you.
Thank you, Katie. Kathy, you had a follow-up?
Yes, I had one other kind of similar but different question. I know our kids are practicing football, volleyball, soccer, all those fall sports. Is there a metric or something that would halt? I know Georgia went to spring for football and, others are doing other things. And I wondered what we're doing in Indiana or whose decision that will be too.
Locally, and you've had a lot of discussions, and your staff has had a lot of discussions, and FSSA has had a lot of discussions. We all have, but it's ultimately a local decision. But you want to share a little background on.
Right. So we've had lots of discussions with superintendents and with teachers and with our local health departments across the state. We have certainly seen cases from these contact sports, from these teams of individuals getting infected, and that's to be expected. I've said all along that I think that this is a decision that will be made not only locally at the community level with the schools and the public health people in the community, but also individually for each family, depending on that individual child's health and the family's health and who that individual child might bring an infection home to that lives in the same home. I think all of that is a personal decision that needs to be made. That being said, we will see more cases of COVID with these contact sports because you cannot do wrestling and some of these other sports without being in each other's face. I think it's really important that no matter whether these sports go on, it's critical that when we have fans there, when we have kids in the dugout, that we still continue those same public health things that we have been drilling into your head, and that is you have to socially distance. When you can, when you're in the dugout, when you're on the sidelines, when you're in the stands, you should still wear your masks. You should wash your hands carefully. You should stay home if you're sick or someone in your home is sick and they have COVID-19. You've been a close contact. It's really, really important that we continue these things because we have case after case where you would assume that many, many people would get infected, but they don't, because people followed simple, basic public health measures. Now, again, it's hard to do that with contact sports, but we really do believe that will be up to, unless we see metrics all across the board way off kilter, be up to the local individual superintendents and their public health to decide.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Appreciate talking to you today. Two questions real quickly. On the first issue of voting, would you be open to perhaps a line on the absentee ballot application, which basically says if you are concerned or affected by COVID-19, that is reason enough for you to mail in your ballot, and that way this kind of takes care of that whole situation or problem. And my second question is, based on the data that you've seen so far, do you see any changes at the end of the month, or then you end up leaving 4.5?
I'm not going to make any predictions into that. Look into that crystal ball on your second question. We'll cross that bridge when we come to it. We're fairly or almost militant about being disciplined on that, and we'll continue to be. So that's to be determined. Also, your first question is somewhat legalese too. You're an attorney, but if you're asking me legally, what does it mean to be confined or who confines, then we'll also address that. But I am waiting on the case before the Attorney General right now. I want to hear back on that before we start to entertain different language. Also, it should be said that when we're talking about this no excuse, and there are a number of excuses already articulated, that's statutory, and so the General Assembly would have an opinion on that as well, rightfully so. And so going forward, we'll address this moment of time over the next 30 days or so. But I do want to see the case before the Attorney General, and then we'll look at what you're honing in on. What are the excuses? And they're right there in print. And if you know that you're going to be confined on Election Day, then you're going to be confined on Election Day.
Steve?
We just want to extend our condolences for the loss of your father recently.
Yeah.
Thank you, Dr. Fox. We appreciate it. Thank you.
Steve with KPC Media.
Good afternoon, Steve.
Steve, you should be able to speak. We'll come back to Steve. Whitney Downard, CNHI.
Afternoon, Whitney.
Good afternoon, Governor. I have a couple questions to follow up on Dr. Dan's staff testing announcement from last week.
Sure.
I wanted to ask him specifically whether or not there was any action taken from this testing in June, or whether they didn't, even individual nursing homes weren't able to do anything since it didn't provide, quote, a sufficient basis to strategically target our testing.
Okay.
And I was wondering if the state is going to publicly release these testing results, and why only in the ballpark of 80% of staffers were tested. And I have one follow-up after all that.
Okay. Dr. Dan will take both of those, and then we'll get to your follow-up.
Hi, Dan Rosiniak, Chief Medical Officer for FSSA. I will attempt to answer both of those. So the first one was around, the second one was on, let me start with the second one because I remember that one. The second one was around releasing those results. Those results to some extent are going to be released when we come out with the dashboard next Wednesday. So you'll see by facility whether a staff has tested positive and a little bit around the date when that occurred. So when we have that dashboard ready next week, which is the intended date, you should be able to get an idea from at a facility level from a staff standpoint. In terms of the first question, which was on whether any actions were taken, remembered it. So the short answer is we always take action when we hear about positive cases. So if a facility had a bunch of positive cases, then that might be an indication, for instance, to send in a strike team to do widespread patient testing. And I know that we've had strike teams out as part of that. It might also involve changing infection control practices. And as we've expanded the number of infection preventionists around the state, I know as we get back some of those results, we've been able to utilize their expertise as well.
Whitney, you had a follow-up?
Yes, and so my follow-up is, what does retesting in August hope to achieve if we weren't able to get any, solid results from the June testing?
Yeah. To some extent, June was twofold. One was we wanted to test all the staff so that we could identify asymptomatic workers so that we could have them quarantine appropriately at home and decrease the likelihood that there would be subsequent outbreaks. But we decided as we did that we wouldn't let that opportunity go without also collecting data to determine for us as a state and as a health department if we could be more targeted in how we would do our testing, because obviously testing that number of individuals is logistically and otherwise complicated. So in terms of what we're going to do in August, it's going to be the same initial goal in June, which is how do we identify folks working in long-term care facilities who might have COVID and don't know it so that we can appropriately quarantine them. In addition, one of the other questions I failed to answer, but I'll answer, is that why only 80%? So there are a lot of things that go into it, and we are still doing some analysis on the other 20%. So for some, it's because they had already been tested. So they may have already had a test. For some, they may have already had COVID, and we weren't requiring folks who had had a recent episode of COVID to require retesting. For some, there is likely some duplicate staff on people's roles. So you might have a staff that works at 2 or 3 facilities. They may be counted as an employee for each facility, but they would only have required testing once.
Yeah, and I should say I just remembered as Dr. Dan was speaking to Abdul and Kayla, I believe, when I said that the case was before the Attorney General. It was actually before a federal judge, but it's the Attorney General who is representing the Election Commission and the Secretary of State. So we'll hear, I should, with all due respect, say we'll hear from the federal judge and from the Attorney General, and then that will help us inform as we go forward for the kind of final Labor Day stretch toward Election Day.
Brenda with Hometown Media.
Afternoon, Brenda.
Good afternoon, Governor. Thanks for taking my question. This is for Jacob Sipe about the rental assistance program. I found that information really interesting, that only 5 counties account for almost half of the applications. And I'm wondering if we could get that breakdown by county so we can maybe help and better circulate that in our areas.
Yes, definitely. We can share the breakdown for all 91 counties. I can share that information in the future for you to see. I will say that a lot of the outreach that we're having is being done at the local level. We had created a marketing and communication toolkit that we provided to our communities to share this information, and they've done an outstanding job of informing our renters about the rental assistance program. But no, I could be happy to share more breakdown based on all 91 counties in the future.
Thank you, Brenda, for helping us get that out. This is something that we talk about all the time, is making sure folks have awareness so that they can access the help that is there.
Julia with Wish TV.
Good afternoon, Julia.
Good afternoon. A group of governors are now joining together with the Rockefeller Foundation, and together they're buying 3.5 million fast-acting COVID tests. They are welcoming additional governors to join that agreement. I'm wondering, are you aware of that deal? Are you open to potentially joining?
We are aware. We were aware, and we have made our own decision. You want to elaborate?
Right. We were aware that these governors were getting together and had talked with public health people in other states about this. As we looked at it, we formed our own lab testing network to bulk buy reagents and equipment in early May. And that was really for the PCR, the rapid throughput testing that our 10 labs that are involved in the lab testing network were using. And we have been able to increase the output from these labs and even get new labs that were not doing testing on board by helping with equipment and reagents. That being said, we've spent, I think, a little over $4 million on that at this, $40 million, I'm sorry, at this point in time on that. And we are still looking at all options available to increase testing here in the state of Indiana. So certainly, as the antigen testing becomes more widespread and accepted, we will certainly be looking to companies that are doing that also.
We'll go back to Steve with KPC Media.
Steve, good afternoon.
Hey, can you hear me this time?
Perfectly.
Thank you. Zoom was bugging out on me. Dr. Box, I have a question about positivity data. Last week, you were kind of reading my mind and said that the state would be releasing the total number of tests, which is something I was looking for. I was wondering with the way, it's my understanding that the state is still calculating positivity by taking unique cases divided by unique Hoosiers tested. I was wondering why you're not taking cases by total tests, because my understanding of doing it the former way, you could get days if a person tests positive on a second or third test, where it's my understanding that the state would essentially log that as one new case, but no new tests because they had been logged as a unique test prior to that. Does that make sense?
I understand, and that's why we started specifically reporting this is, when we do the percent positivity, we want to look at unique individuals that are positive over those tests that were done at the unique tests that were done during that day. Realistically, we have people that are trying to go back to work and they're not following necessarily the new CDC recommendations. So they're retesting and retesting and retesting and getting multiple positive tests throughout that period of time, which would very much skew those positivity tests. It's not that they're still shedding actively replicating virus that can infect other people, but we do know that can be positive for up to 90 days afterwards. The CDC says you don't have to quarantine people and you shouldn't retest them. That being said, we also have people that get retested over and over and over again, sometimes because it's long-term care, sometimes because they're healthcare workers or in a high-risk field, and those would be negatives, and that would tend to dilute it. So that's why we've taken that approach. In all honesty, we have reached out to the CDC, to CSTE, which is the U.S. Group of epidemiologists across the United States, and there is no set definition of how they want you to present that data, and every state is doing it a little bit differently. Some states are even including antibody testing in their positive tests, and I can tell you we are not doing that. We do include point of care PCR tests, and we do include antigens in our testing.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Hi, I have two quick questions. I'm going to start on education and then I have one follow-up. The first question on education is, last week you changed the mask guidance for schools to say that kids can sit 3 feet apart with neither child wearing a mask. I'm asking, why would we suddenly change that from 6 feet when that's all we've heard for months? And what happens if a kid sneezes or coughs?
So it's an excellent question, Nikki, and we had been messaging that with our superintendents, with our local health departments, based on the American Academy of Pediatrics recommendations of ideally 6 feet, but minimally 3 feet. There have been a lot of studies done right at about 1 meter, which is a little over 3 feet, to show that the spread of the virus is very minimal. And so when a lot of schools were under the situation where they couldn't get, many of them could get 4 feet, 4.5 feet, but they couldn't get a full 6 feet, we worked very hard with them to make sure those desks were all oriented in the same direction, and then gave them the opportunity to allow the kids to take those masks off while they're sitting there working at their desk, facing somebody else's back, so that if they sneeze or they cough, it's there. Still underlining the importance of putting that mask on to go to the bathroom, to go get lunch, to go wash your hands, to go to the school bus, to come in and come out. And so the most of the time they would be wearing their masks. But this is really new to a lot of kids, so we were really trying to help to start break them into this. And, as you know, we've requested 3rd grade and above, but we strongly recommend it for individuals that are 2 to 7 years old also.
And my one quick follow-up for you, Governor, is you mentioned that you didn't know of any Indiana cases that resulted from going to the polls in June. Can you tell me if you know of any verified voter fraud from absentee mail-in from the primary?
I do not. And that's not what's, driving our thought process whatsoever. I have a lot of confidence in not just our election commission, but county by county, 92 counties pulling off our elections. I want to make sure that voters have the safe options, both at home via absentee, traveling boards, and in person. And we have 4 weeks to do all that safely.
Erica Herron, the Indianapolis Star.
Good afternoon, Erica.
Good afternoon. I have two quick questions about schools. The first, if practices like social distancing and cohorting of students are how we reopen our schools safely, why are we not making those requirements for schools to put in their reopening plans? The plans, we don't even have require plans of schools to reopen right now. Yeah. And then some of this information, like that, the hotline that was given out, why is that just coming out now when some schools have already opened and are dealing with cases?
So the hotline came out today because they all have a hotline to us anyway. So they're calling us anyway, and we're having those discussions between Dr. Weaver, myself, my state epidemiologist, local health partners. So those calls are occurring anyway, but we want to make sure that they have the ability to call and maybe ask a question where they don't feel like they have to wait any period of time to talk to myself or my chief medical officer or my state epidemiologist. So that hotline is the ability for administrators to call and ask questions that we know may be similar questions that are asked over and over again. And we have a lot of frequently asked questions that we've provided them with. The second thing is, why aren't these requirements? If we had come out and said every school has to open exactly this way, and this is exactly how you have to do it, and this is exactly when you have to do it, we would be facing, why do you have all these requirements and you don't allow local communities, local public health, and local superintendents who are really in charge of when their schools open, when their schools are closed, et cetera. I mean, these are all recommendations. They have always been recommendations. We are a home rule state when it comes to this. Even what I talk with my local health departments, for the most part, are recommendations. Now, we work very well together, and it's very rare that we disagree on any of this, but quite honestly, we really try to be respectful of the community's ability to make decisions that they think are best for their own system.
Yeah, and we're working with different urban, rural, suburban, different positivity rates, lots of different numbers. And so to think that you could have just one blanket policy, we think it's best, and it's working best, that these school corporations are working with parents and faculty and teachers to arrive at the safest and best, the most ideal learning environment there. Katie?
Yes, one other thing I would add is allowing the locals to make this decision provides a level of nimbleness. So as maybe a case turns up, they can quickly take their reentry plan, they can improve upon it, grow from it, and make it better. And it's a quick move. It's a continuous improvement process that our locals are working through. Thank you.
Thanks, Katie.
Sheila with WLKI.
Good afternoon, Sheila.
Good afternoon, Governor. It's nice to see you and the Lieutenant Governor and Dr. Box today.
Good to be with you.
We sure enjoyed the Lieutenant Governor's recent visit to Northeast Indiana.
She's a regular.
Yes, she is. So before I ask my question, I would like to say, as a journalist, I've really appreciated the breakdown of the county by county positivity percentage. Mm-hmm. Listeners in my area seem to like that breakdown as well. So my question today stems from, I know that you and your team have worked a great deal with educators throughout the state on plans to reopen schools safely, but obviously we still have Hoosiers with a variety of opinions on the issue, from that person who may be feeling nervous, whether they're a parent or a teacher or even a student, who may be fearful of returning to an in-person setting, or even the person who's on the other side of things who may be a little bit disjointed about having to wear a mask. What would you say to those people on both sides of that spectrum?
That we understand that this is a very difficult situation, and that none of these decisions are, I want them to know that none of these decisions are being made lightly, that all of their superintendents and their administrators are working very hard to try to do what they feel is best, not only for the students, but for the teachers, the administrators, and the staff of the schools. I would like to say that I understand the fear that people have, because I've seen the fear in people who work in Kroger and people who work at the hospital, my colleagues that have been working through this whole time. And so it is different now for teachers to be going back to school. And so I hear a lot. I have a lot of emails from them, and I respect that. I do think that we need to continue to look at those individuals that are at highest risk, whether those be students, staff, faculty, and make sure that we are protecting them and thinking outside the box per se to make sure that they can continue to educate or continue to go to school in a safe way and be able to get the education they need. But I also want them to understand that it's really important that those children that don't have the ability to really have the help they need to do e-learning at home, that may have safety issues because they're 6, 7, 8, whatever, 10 years old and maybe actually left home because they're not going to school. And those individuals that don't have food security and the mental health and the behavioral issues that we've seen. There are a lot of parents, equal numbers, that have reached out to me and said, my kids need to get back to school. They need to have connection once again.
Yeah, and I would also say, Sheila, that COVID-19 has caused virtually everyone, every Hoosier, to make adjustments. I mean, it is a very fluid situation, and school is no exception. And so we're working with school corporations to help them develop a protocol, a plan that has options so that when you find yourself in a certain situation or stage or scenario, you can make those adjustments. And it won't be uniform across the whole state of Indiana, just like it won't be uniform across the whole country. But I have too received a lot of input from school administrators saying how excited they are to get back. And so, yes, there are different opinions along the way, but it's also really brought us together from the most local perspective with your local health department, local school corporation, with the state and all of our resources. It's really brought us together to get through this together, and it will change. There will have to be adjustments. So that is, understandably, Sheila, that is a little unnerving, but the comforting fact is we are all in this together, and we're making the best decisions for kids to learn holistically in the environment that best serves them.
One other piece that I'll add instructionally is earlier I mentioned that the vast majority of schools who have gone back to this point are providing an in-person option and an online or remote learning option. So for parents or medically fragile students, there is an option instructionally for that child. So just wanted to add that in and make sure Hoosiers are aware of that.
Stephanie from WRTV.
Good afternoon, Stephanie.
All right, can you hear me?
Crystal clear.
Perfect. Okay, so two things. I just wanted to clarify from the first question from the first reporter about tracking in schools, because I know, Dr. Box, you mentioned you're trying to go over the legality and privacy issues. Would you consider publicly releasing a dashboard that tracks coronavirus cases in schools in real time if that was legal and everything was okay privacy-wise?
Mm-hmm. So what I would love to be able to report on is every school reports, and I'd really like to simplify this for the schools. If we can pull that from our data coming in and cross that with data from what we know is from schools, we know a particular school, this child goes to this school, if that could automatically come out and populate a dashboard, not with that individual's name, not with any personal information, but basically just that there is a positive case in this school amongst that student, teacher, or the staff.
Okay. And second question too, if you could just kind of speak to, were you expecting schools to have cases right away? Was this something you were anticipating? Just kind of candidly speaking to that.
Yes, I was expecting that because throughout this entire pandemic, we have seen the increasing numbers of cases in our young people, not only in children, but most importantly, the highest growing group, as you know, is that 20 to 29-year-old group. But the 0 to 19 is specifically, if you narrow that down, that's kind of the 14 to 18-year-olds. And it really makes sense, right? Because they're the ones that are out and probably not socially distanced, and they may be sharing a lot of different germs together in different ways, whether that's their e-cigarettes, God forbid, or a solo cup with their Diet Pop in it, or other things that teenagers tend to share.
Yeah, and I hope you're not detecting hesitancy on Dr. Box's part because of intent or motivation. We got to make sure that it's back to the old good data in, good data out, and making sure what is consumed is accurate data. Folks are already expecting instant reporting on cases, and you hear one thing over here, and we got to verify it. And already the information that we put out, that we post for the world to consume, there's a delay. We have to true that up, and so there can be confusion when you're waiting 4 days to get a 7-day, positivity rate for it to be accurate. And so a lot has to go into this, including working with the Department of Education. So this is a health issue. But just imagine if we said, well, we're going to report on every time there is a case of the flu in a school. So we're building this airplane in flight, and we want to make sure that when it goes live, that it has integrity.
Our final question is from Mark Bennett with the Terre Haute Tribune-Star.
Afternoon, Mark. Mark, you have to unmute your phone, as Rachel would say.
Can you hear me now?
I can. Thank you.
All right, great. Thank you for your time and your this opportunity.
Sure.
To go back to a comment you made just a few minutes ago about your confidence in the election system here and the officials here. Can you elaborate a bit on why you have that confidence? Should we be in the position where expanded vote by mail is extended to any Hoosier who hopes to do that?
Well, what I want to make sure is that we have an efficient process that is safe. And that includes absentee voting with those excuses that have been listed, which have been contemplated by the General Assembly over the years, which have been expanded significantly since decades back, and that we have in-voting options, including 28 days prior. So 4 weeks prior. I know that there has been fraud in the past. There probably in every state. But I have high confidence because we have very skilled clerks throughout the state of Indiana and many steps and along the way to verify. What I want to make sure is that our system can handle the volume along the way. And we are not in a stay-at-home posture. If you look at the mobility and the folks that are traveling out and about every day, whether they're working from home or not, we know that we don't want to go back to a stay-at-home if we don't need to, and we don't need to. So voting, in my mind, fits into that scenario.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.